Conversations about death can be uncomfortable, but there's a profession working to make them easier. You may know about birth doulas who help families welcome a baby. Now there's an emerging field doing something similar for death. They're called end-of-life doulas. In Ohio, Jen Pachano met with one who shares her approach to planning for the final sunset.
We spend more time planning our annual vacation than we spend thinking about the last phase of our life, and we need to do that. We need to be prepared.
Annie O'Neill has a background and a business in geriatric care management. As part of that, she offers her services as a death doula.
What we try to strive for is as few regrets as possible at a very challenging time.
Death doulas have been around for 15 years, originally working with hospice care, going to a hospital to be the first one in once a patient was given a terminal diagnosis. Rather than focusing on the people around the patient and their anticipatory grief, she says an end-of-life doula focuses on the patient.
I believe that no good decision is ever made in a crisis. I always try to help people stay ahead of the curve.
She helps patients talk about their pain management options, navigate decisions about care, and where and how they want to live out their last days.
And when I begin to notice signs of decline, even subtle signs of decline, I'm able to say to them, let's talk about some additional support.
Dr. Laura Hoeksema is the medical director for Cleveland Clinic Hospice. She agrees that it's better to engage with these kinds of services sooner rather than later.
We actually find that hospice is most beneficial for patients and their families when patients receive hospice care for weeks or months, where patients and their families really get to know our team. We can provide that guidance through the dying process.
Death doulas also do legacy work during the final phase of life, conducting workshops at nursing homes to create projects with patients to help wrap up their life.
One of the things I saw recently in a cemetery was a fudge recipe on the back of the headstone.
That's awesome.
Are you kidding?
Death doulas are even helping people write their own obituaries.
I want to say who I am. I don't want somebody to sit there grieving and sad and say, surrounded by her loved ones. Okay,
Fill in the blank.
Yeah. Tell us who you are, how you lived, right? Put that in your last opportunity to speak.
Dr. Hoeksema says death has become less medicalized in this country and more personal. Both she and O'Neill say they'd like to see more people taking advantage of this kind of service.
Wow. Thumbs up on that story.
Right.
Yeah.
Right.
I mean, they got everything right in that story. That's really what we all stand for. And the terminology, the thought behind it.
No
Amazing.
good decisions made in a crisis.
Absolutely.
And I have been with a lot of people when they've gone through their final sunset, and that experience and having the ability to be there and help them and the family, but focus on them, is paramount. One of the things I do, and they didn't address it, is every person I've been with, the last thing after they've gone through their final sunset, I always give them a good clean bath. And I always change their clothes, always. Because dignity doesn't end at the final sunset. Dignity goes on with that person.
What I liked hearing is that the Cleveland Clinic Hospice worked with the death doulas, so it wasn't seen as a competition. Death doulas are private pay, no government entity pays for it.
Right.
But when they work in conjunction with each other, and I have to confess, she's a care manager like I am, and I just love that she brought it to the forefront. I just feel so proud.
Yeah.
But I think it's good that people want to talk about it. I think for so long we've been afraid to talk about certain things. Probably out of fear. People didn't want to talk about death.
Right.
But they were very happy to talk about life. So that's why you had the doulas to come in and let me help you. But the support is needed just as much at the end, if not more.
Right. And I agree, it is even more. And it's just this emerging field that's now opening up the lines of communication so people can really start to talk about the fact that we are not immortal. We do have mortal bodies and we will all pass away at some point. So if it's going to happen, we need to be talking about it. We need to be preparing and helping our families through it.